No, nothing from David. Right, we'll go to Margaret. You are on mute at the moment, Margaret.
Hi, I'm Margaret Parker and I'm a newly appointed Director of Health Watch Rochdale. Thank you.
Thank you. Have I included everybody? Just David?
I don't know if you can hear me now.
Yeah.
You can?
Yes.
We can't see you, but we can hear.
Oh, right. I don't know how to stop that bit now then. So stop video. Share screen. Don't know how to get myself on camera.
Right.
Sound as good as me, David.
Right, well, at least you can hear me.
We can hear you, yes.
Yeah, right.
So just to inform you all that I'm going to start recording the meeting as well, and that's for minuting purposes. So I'll just share my screen. Have you all got a copy of the agenda that you can view? It's been shared on our public, on our Health Watch website, so the information is on there. So it just saves me having to share the screen because the information's already out there.
Yeah, I think everyone's should have a copy of it.
Yes, thank you.
Thank you.
Right. Questions from the public. We have had 2 questions from the public. Okay, do you want to share those?
Yes, so they all got shared with the board earlier this morning, just to provide you with an update. The questions can't be answered, they will need to go away and they're not specifically relating to Health Watch. However, I will just read them through. So question 1, the free NHS flu programme is normally for people aged 65 and over, pregnant women, people with certain conditions such as kidney disease, asthma or heart disease, and carers of those in care homes. Frontline health and social care workers are also eligible to receive the flu vaccine. The flu jab is also free for children over 6 months with a long-term health condition, those aged 2 and 3, and those in primary school. It has been reported widely in the national media that this programme will now be extended to include anyone aged 50 and over and children who are aged 11 by the end of August this year. The first year of secondary school, anyone living in a household with somebody on the NHS shielding patient list for COVID-19 will also be eligible for the flu jab. And sorry, that's a free flu jab. I get my flu jab free each year since I'm a key worker in an area designated at high risk of community transmission, and I'm grateful for the NHS for it. However, I've been told that ASDA Rochdale are still rationalising over the flu vaccination in age-related groups, saying that there's only free to those over 65 and over. Is this the case, and is it possible for Rochdale Health Watch to clarify this, since I know that it's causing some confusion locally with people anxious to get the flu vaccinations? So that's question 1. And question 2, are old and vulnerable people still being discharged from NHS hospital settings without first having a clear COVID-19 test in local care homes? So what we will do, there was a bit more wording to that, but that's the top and bottom of it. What's the testing on? What we will have to do is we'll have to go to external providers and statutory partners to receive the criteria around the flu jab for this year, and we will respond to the individual. Any response that we put out there will come to full board before it's shared within the public domain. So thank you for the gentleman sending them in, and we'll pick them up for them to move forward.
Thank you. Now the next thing we have to do is approve the minutes of the last part 1 board meeting, which was back in March. It seems such a long time ago. And it was probably the last time we actually all met up in person. So it's for the other board members, can I ask if there are any comments on the minutes of that meeting?
No.
No. So can I say that those are approved?
Yeah. Yes.
Yes.
Thank you. Any matters arising? I think anything that might be arising from those minutes is probably covered in the remainder of the meeting. And I think particularly as this was just about pre-COVID, so obviously things have changed considerably since then. So there probably isn't anything, as I say, everything else I think will be covered in the meeting and in the updates that we give later. As usual with all the board members, I have to ask, are there any declarations of interest from any of the board members?
No.
No.
Thank you. The action log.
Do you want to talk through that, Jane?
Yes, please.
I'll bring that up on screen, so hopefully you should all be able to see this now.
Yep.
So starting at the outstanding actions 333. So send letter to all nursing care home providers to inform them about Health Watch Rochdale. That was, it's been a lot outstanding action just because we've not officially sent the letter. However, we are engaging with them through virtual platforms. So we're updating them in our work programme in that way, so that can now be closed off. 328, the specification for the role of vice chair and chair, they're still on hold. They need to be taken back to the HR subcommittee group and then brought back to full board. So it's just not a piece of work that's been a priority since COVID kicked in, but we'll pick them up for this next quarter. So 335 advisory group update. We've got the chair with us today, Karen Kelland, who's obviously prepared a paper and he's also going to give an update, so we can close that off now. There's new terms of reference to be approved. CEO update report to organise an extraordinary finance subcommittee. That was completed, so that can be closed. 336, that's now closed as well. The annual report financial figures have been approved and the report got published in line with our timeframes. 337 to send the board of directors the Health Watch Rochdale annual account report for full approval. That's now been approved and our community accountant has put those figures onto our micro accounts on Company House, so with filings done for the year. 338, the business plan update report, to share an update business plan following the update in relation to the work plan priorities. So that has been complete now, and that was done as an external comms update to say how we're going to be working for the remainder of the year, and the slight change in our partnership approach. 339, business plan update report again, to share an external statement, which again, we've done that as part of that external update, which has given a full update on our work plan priorities, as well as giving an overview in regards to the new staff. 440, public questions, share a draft update to the public questions with the Health Watch Rochdale board for approval. So they got approved and they got shared and they are on our website. So that can be closed, and on confirmation by the Health Watch Rochdale board, make the questions to the public questions available on the website. So again, that's me, yeah. So they're all on the website, all our information gets shared. So yeah, action log complete and can be closed off.
Thank you. CEO update. Kate's going to give us a presentation on an update of
I am. So
all that's going on.
yeah, so previously the way that I deliver an update in part one to the board would very much be through report formatting, and that would be in various ways, such as ops reports, which was very statistical. And what I felt was missing, and from some feedback from board members, was that actually what are we doing on the ground? So this presentation is going to give a real broad overview of what we're doing at the moment, but it's a starting point for a report. So I'm aware that more statistical figures will need to come through and look at various ways of, of understanding what you guys want to hear on the back of my reporting. So I'm going to share my screen and I'm going to switch my camera off because it just puts me off having my face there while I'm talking. And I'm going to talk through the report. I'll take questions at the end, and unfortunately I won't be able to click on any of the links that are in the presentation, but I'll share the presentation again after the meeting to make sure there's, you can all click on the links. For some reason it won't let me do it when I'm on Zoom. It's because it takes me onto website links. That's what they're for, the further information. So let me just start sharing my screen now. So hopefully you should all be able to see that now.
Yep.
Yeah.
Bear with me 1 minute. I can't now. Okay, now I can. So this is my board update. Sorry for going on ahead of itself. This is my board update to cover July, August and September. So first of all, it's so great to see our new board members around the table. If you've got, like I said, if you've got any questions or want a bit more information, if it's not something we can pick up online, by all means, I'm happy to have conversations away from the meeting as well. So what we're going to cover today, meet the new team. So give you an overview of the new team, an update on some of the work that I've been specifically working through, an update on our communications, our engagement and our governance, as well as where we're up to with our volunteers within the organisation. What's next, so a bit of horizon scanning for what we've got to come, and then take any questions from you guys on that operational update. So first and foremost, to meet the team. So we've recently gone through a new restructure. So Alex Leach, who was our operations manager for 5 years, left the organisation to become chief exec over at Health Watch Salford. So with that, during the last couple of months, the recruitment drive and restructure of the organisation has been a key task for me. So Claire Birch is our information and communications coordinator. Now, Claire has been with the organisation for 5 years now. However, it's a promotion for Claire and a step up to more accountability around comms. And the other 3 remaining staff members are new to the team. So we've got Claire Yardley, Naomi Kenyon and Tracy Copeman. And then obviously myself as chief exec. I just need to get a new picture. So my internal update in regards to what I've been working on. So obviously I've touched upon there the operational restructure, and that's majorly been about the staff recruitment and also obviously the staff development and the support and the training coming into the new team. We've signed up to Care Opinion as an organisation, and that blue link there, if you click on that, it will take you onto the Care Opinion website, and it just gives you an overview as a Health Watch what that means and what information we're going to be receiving. And it's basically a secondary data source for us on patient experience on Rochdale services. And what we're trying to do with that information is I've had a lot of meetings over the last couple of months with senior intelligence leads around data to see how Health Watch can feed patient experience into the system better. And that triangulation of patient experience across the whole system. And I'm pleased to report that I am breaking barriers finally. So hopefully within the next couple of months, we should have something in place for a clear pathway as to how our data is being used. So Health Watch in Greater Manchester, I've been attending our weekly Zoom calls there. There's work going on around the future development of the group and what the ask is at the Health and Social Care Partnership at Manchester level. And also something that's just come on our radar across the GM for a certain number of us is the changes around the North Manchester General Hospital site. So external staff team development with Action Together and Health Watch. So Action Together deliver the infrastructure service support in the borough. And what we found is as they've only been in post for maybe over a year now, so they're really finding the feet in the way that they're working. Now in other areas where Action Together deliver the services, they also hold their Health Watch contracts, and that's over in Oldham and Tameside. So we're conscious that there could be duplication here and that we need to be working in partnership. So we've decided to start having, a regular team meeting, regular one-to-ones with our staffs to ensure, the crossover of work and that partnership approach. So we've been doing from an external perspective, sorry, I'm having to move things around so I can see my screen, the COVID-19 joint survey with Rochdale Borough Council. So we picked up a survey that went out from sort of May to June. We had 700 responses and 97 of which signed up to focus groups. So we've been doing a lot of work analysing that data. So we made recommendations to some strategic meetings across the statutory partner leadership model. And I presented the findings of the survey from inequality perspective. There's a lot of information there at various meetings across the Health and Social Care Partnership. And for me, it's now the what's next. So how, now they've got this information on how things have been for people during this period, a service is going to change and is information going to be provided. So there's still a lot of accountability standing on that piece of work still. So obviously I've been working on the advisory group development. We've had a development session with the members of the group that we already have to see how we move forward with it. I attended my quarterly contract monitoring meeting with the council, and just to say that we've got positive feedback there, and we're just waiting for clarification on final sign off on our financial figures for next year. So externally, what's been going on? So Healthwatch Rochdale, as I mentioned previously, we did our external work plan update, which was a statement that went out and gave an update across our priority areas for the rest of the year. So there's some local engagement coming up, which is being run by the LCO, and it's around local commissioning intentions. So that's been a massive piece of work that Healthwatch have been involved in regards to what message is going out, and we're actually providing a platform for some engagement through our focus groups on the back of our surveys. So hashtag Together Rochdale. So hashtag Together Rochdale, I've been strategically developing the group. The group is a comms group which was set up at the beginning of COVID by Healthwatch Rochdale, because we noticed that there was duplication in comms and there was missed messages. So it brought the voluntary sector and the statutory partners together, and you know, there was a consistent message, and we'd talk about comms and how that was being delivered. There was been buy-in from leadership for this group to develop. So I've created now an external term of reference, and what we're trying to really push for is an external purpose and future development of the group. The only concern that's been raised there is whether it's appropriate for Healthwatch to continue facilitating that, because obviously our role is to scrutinise on the comms that's going out, and if we're facilitating, I don't want to lose sight of that scrutiny. So another piece of work that's going on across the borough, which is led by Action Together in partnership with the LCO and Healthwatch involvement, is the cooperative engagement model. So this is a partnership piece of work to sort of like standardise the way in which we engage across to all our Rochdale residents, and it's identifying the 4 key areas of what engagement is. So it's identifying at the beginning of any piece of work, whether it's information giving, whether it's consulting, whether it's co-production and co-design. So it's really setting standards into how we say we're going to engage with our residents. So we've been involved in that, and in supporting the write-up of the toolkit, as well as looking at how we can link into the cooperative engagement model. So obviously our Youth Watch, which is in development, our advisory group will link into there, and of course you as board members as well. So Rochdale Equality Assembly, I presented the survey of the findings of our first initial survey to the group, and I also held a conversation in a breakout room about health inequalities, and the report's attached in blue. If you click on that, that takes you to the report. Obviously, equalities has been highlighted as a key area for us to keep review of throughout the year, and we're involved not at every level, so we've still got some barriers to break there, but we're involved in conversations about how equality is being managed and how the impact assessment's going ahead. So from an external perspective, our local care organisation, One Rochdale, so they're currently in the process of doing a governance review. So I've met with the chair and a couple of the coordinators there to discuss how I'd like to see more involvement from a Healthwatch and a patient experience perspective. I'm conscious that on One Rochdale, there is no patient voice at the moment at board level. And in the past, I've been knocked back when raising escalations to say that they have carers' voice on there, and that's covered through Encompass. But for me, that's concerns because they're more of a provider of that role than a independent voice of carers. So I've been involved in the governance review and, you know, fed back there, presented findings to the senior management team and sort of held some of them accountable, people around the table, as to what our findings were showing, and identified areas for focus group feedback to be reviewed. So all our feedback that's been pulled from our focus groups will be fed back into the LCO, And again, it's looking at that two-way offer. So we're providing this feedback. What can we go back and say to the public on the back of this information? So we're really focusing on that you said we did approach moving forward. So MEAN, which is Every Adult Matters, stakeholder event which we're involved in. And it's a big piece of work that Rochdale Council are pushing out across the borough. And if you click on the link again, there's a lot further information there. So Building Back Better, this is the name that's been given to some engagement work that's going on around mental health services. And Health Watch Rochdale attended the stakeholder event, which was run by Tracy Harrison a couple of weeks ago. So that's a bit of an overview of what I've been up to. I'm going to move on to comms now. And like I said, I'll take the questions at the end. So in regards to the communications update, the Together Rochdale group is in development. So our website is currently holding the Together Rochdale platform, which is being utilised as a communication tool for COVID-19 messaging in various languages. So this has been a major partnership piece of work, and a press release has gone out on that today. And like I said, the Together Rochdale is an independent branded, but we're hosting that on our website. So please do have a look at that because it's brilliant work. We send out a monthly partnership newsletter. So feedback that we're getting on the ground at the moment is, why can't the council bring back a newsletter? We are providing a virtual e-bulletin at the moment, and partners do, feed information into us so that we're given a broader update, not just about, what we're finding. So that's been a really good, and it's been really well received, and we're looking at seeing how that can be developed. Under the Together Rochdale, the group worked on disseminating the equality report after the event went ahead. The group are currently in the process of putting together a public-facing partnership report, which we've named You Said We Did, on the back of the COVID-19 survey. So the final survey report, which is a professional report, has been shared with the partners that attend the Together Rochdale group, and they're going away, in fact, on the back of what patient experience was given, they're going away to provide an update on what their service has done already to improve things and give that chance of a partnership approach. So it's really going back to the people that got involved in our survey. So the COVID-19 survey, obviously, the group shared that and really pushed that as far and wide through the comms that they work with. And like I said, the translated information through the partnership work as well. So if you remember, we ran an external feedback campaign, which was run through an organisation called Cornerstones, which have worked with local statutory partners in the borough before, and we got a really good. They gave us a really good rate for for such a small organisation. They really worked with us. We've now got an analytical report to review, so we'll feed some of that back into the board. But as a whole, it was a really positive experience. However, would we spend that sort of money again? I'm not too sure. So website development is a key area for our comms. We're looking at creating extra tabs on our website, and we're also going to be looking at accessibility assessment on our own website, and we're going to ask our volunteers to pick that up. What we're conscious of is we're quite limited because it's a Health Watch England platform. So, and it's quite a new website as well. So we have to sort of like go away if we want development work on there, but we're really keen to make the information that is on our website stand out a little bit more. So if you want to volunteer, it's got its own tab, whereas at the moment you're sort of scrolling through to try and find that information. So we got involved with the Because We All Care Health Watch England feedback campaign, and we are waiting for local data. We've already had one batch. We're waiting for local data to be shared with that, so that we can feed some trends into our local secondary care providers, and that was around discharge from hospital. So the Health Watch in Greater Manchester, I've touched upon it in regards to my work programme. Rochdale set up the meetings, and it's the officers meeting, which gives a chance for everyone under chief officer to get together, talk about good practice and work that they're doing. So that's been re-established, and we've had the first meeting now since lockdown. Obviously our annual report was published on the 30th of June, so highlighting all our work, and that was shared with our statutory partners. And then there's some comms statistics that I've shared with you there. So the comms statistics are from July to August, and obviously you can see on pretty much all the stats from sessions. July was a busy month for us on our communication stats, and that was because of the recruitment processes that we had going live. And obviously we also had the external comms campaign. So what we need to do is look at what figures we're pulling as a whole and try and identify what were from the comms campaign, which was paid. I think all in all though, it's great to see that, for example, on our Facebook followers, we've jumped from 66 to 990, which is a brilliant increase for us. And we are feeling that increase in regards to, the engagement that we're getting back from Facebook. So just some stats there to share with you. And like I said, moving forward with the report, it's looking at what is required. So moving on to an engagement update. So during the month of September, we have 17 focus groups that were set up on the back of the COVID-19 follow-up. Now, unfortunately, not all the focus groups have been delivered, and that's been due to poor sign-up. Bearing in mind, we had 97 people which left their contact details, but now the time's come round to set them up. People just aren't necessarily interested. We can't work out whether they're a little bit zoomed out, but obviously returning back to work and normality now the lockdown's been lifted as well. But we are looking at different ways and being reactive to the fact that this line of engagement isn't working. So we have created a survey link in partnership with the council to use their software for analytical purposes. And what we're doing is basically asking the questions that we were asking in the focus group to make sure that we receive that quantitative and qualitative data set. So from an engagement perspective, we've had the advisory group meeting, which was held, and obviously the development of the terms of reference there and the future work streams. And Karen's on the call today to give a further update later on in the agenda. Youth Watch development. So as I said, I've just come off a call and we've just held a stakeholder engagement event specific to youth services and what the offer is at the moment around how we can tap into different youth services that are up and running and have patient voices. And we've met with commissioners. HWR CCG are commissioning us to develop this independent youth watch, and they're really keen, and we've had meetings with them to discuss what the aims are from their perspective, and they're just really keen to get a young group of people that can engage and that can be engaged with on the health and social care system, and want to have that say in the way that the services are delivered moving forward. So we have a virtual mental health forum that's been set up during COVID-19, and that's about patient experience feedback. It's about service user groups coming to the meeting as well and providing us with an update on what feedback they're receiving. The external reports are reported into the Rochdale Mental Health Partnership Board, which is led by One Rochdale, our local LCO. Now the meeting got cancelled in September, so we've got 2 reports to feed in there around patient experience. And obviously on the back of our feedback coming into the meeting, we want to know what actions are going to come off the back of it on our patient. So access has been key. So once they've gone to the partnership board, those reports will be shared and it is anonymous, obviously, on our website. So external awareness raising sessions. So we delivered a session on Wednesday weekly, which is a training offer that Action Together are giving out as the infrastructure organisation, and it's shared with all voluntary sector organisations. We did a session just to highlight the work that we're doing at the moment and how people can get involved with us. And then feedback themes. So obviously at the moment we've got our Health Watch Rochdale website feedback that we are receiving, and now we've got this secondary data coming in from Care Opinion, and what now needs to be developed is a pathway for this feedback to be reviewed, and for me that sits with the advisory group, and then the report would come up to full board. So we're really keen to develop not just internally how our patient experience is used, but externally as well. That's something that I'm really keen to move forward on. And then we also attend, which was a weekly, but now has turned to a bi-weekly grassroots gathering, which is an update where a majority of the voluntary sector organisations in the borough attend, and it's that sharing information So that's a 3-hour meeting which we attend to really get an idea of what's going on the ground and looking at ways we can tap into engagement strands there. So moving on to the governance update. So we've got board recruitment campaign, and obviously we've got 4 new board members which have now joined the board. So great to see you today. I've currently just gone through a 6-hour GDPR audit. We've got a new DPO in place, Sam, from August 2020, and I'm just waiting for the final report to come through in regards to actions that need to be fulfilled there. So another piece of work around the governance is internal governance review, and for me that's looking at the development of the Health Watch Rochdale subcommittees. So at the moment we have the HR subcommittee and we have the finance subcommittee, and for me there's that general purpose missing. So what we're going to do is, what I'm going to do is develop that finance group to cover some of the general purpose stuff as well, and there'll be development there within the terms of reference. So from a governance perspective, the advisory group development, and again that's looking at our internal and external focus to see how the advisory group, you know, hold the information that's coming through to them account on the system. So we've got a board development session with us having new board members. Training is just as important for you guys, and that's booked in for the 22nd of October. I've been working on some business planning and contingency plan reviewing, and I've had support from our new board member, I don't think's on at the moment, Stephen, to see how we can you know, really tighten some of the gaps within our business continuity at the moment. I've delivered on some board induction and training as well. So sorry, I feel like I'm doing lots of talking now. In regards to the volunteer update, so our volunteer contact has been consistent. We've made contact with our volunteers every 2 weeks, and since Naomi is coming to post in August, you know, that's been picked up by Naomi. Alex was doing it previously. And we're introducing the volunteer e-bulletin, which is due to go out in September, and we're just making sure that the volunteers are updated in regards to things that are happening within the business, just like anybody else would. We don't want to lose that contact and that momentum with them. So external areas of work around volunteering. So at the moment, there is a volunteer passport which is going to be created within Rochdale, and that sits with Under Action Together, and we're keen to get involved in that and as to what that might look like and how we can, you know, get involved. And basically what it means is Action Together will hold the passport, the DBS, and then its skill set match for volunteer recruitment drives that are going on. So I think it'd be really positive for us with our future recruitment drives that we've got coming up. And there's also an external piece of work around Northern Care Alliance. So what they're looking at doing is setting up volunteer hubs within Rochdale, and they want some support and development there, and the oversight. So what we're saying is don't duplicate the hubs. You know, we've got quite good volunteer systems set up at the moment, so we're working in partnership with them to see how we can get that right, and Action Together and involved in that as well. So advisory group recruitment is key for our volunteer work, and that goes live on the 21st of September, so Monday. Again, the Youth Watch development, we've had our stakeholder, and we're going to be doing a mapping exercise now to see what voice groups are currently up and running for the youth as to how we can tap into them. We don't want to duplicate the system. We're currently looking at what our virtual offer is with volunteers. We're conscious that our Enter and View programme isn't up and running, and the work that they'd normally do on the ground with us under engagement, we're not doing. So we're really looking at how we can look at virtual offers there. So that we're currently in conversations around a virtual Enter and View, website audits, which I've touched upon, and mystery shopping activities. Another area which we've been asked to pick up is an engagement piece of work for the equality impact assessments on the COVID test sites locally. So that's a piece of work that Living Well and Health Watch Rochdale have been asked to be involved with on behalf of public health. So we're just doing some work there to see whether it's appropriate for us to be involved and whether the engagement is going to be meaningful and whether the information that we pull out of it will actually make a difference on the impact assessment. So we've also been looking at what our volunteer offer is. So currently we have different volunteer roles, and what we're going to look at doing is stripping that down a little bit and going to one core volunteer role. and then everything else being a training offer. So you sign up as a volunteer, and if you've got an interest in entering view or different areas, then that's a training need rather than being a specific volunteer in a specific area, because we just feel that we can offer further development to our volunteers and new people that are joining the organisation. We're also looking at what offer we can give to our volunteers in regards to giving back. So we've been in contact with the Time Bank, and they're looking at coming into Rochdale from March. So basically what that is, volunteers do X amount of hours with them, and local businesses sign up to give them deals on the back of the volunteering hours that they do. So it's a really, really positive piece, really, and not just for our Health Watch volunteers, but I think to bring in across the borough would be brilliant. And again, something that I touched upon on other areas, the website development. So really having that volunteer tab, making sure all our information is up to date, knowing what expectations are, frequently asked questions. So that's all work that Naomi's picking up currently. So what's next? So I broke that down into two categories. So the first one for me is internal, what's next for Health Watch. So a piece of work that's on the cards now is we want to engage with the care home residents. So we're currently in the process of setting up a meeting with care home managers to see how we can look at engaging with residents, and if any of them are willing to sort of pilot maybe a piece of virtual possible enter and view or conversations. So that's coming up. We're in the process of setting that up with support from Jill Adams, who's the independent care home representative for the council. So obviously Youth Watch development and recruitment on the back of the stakeholder event this morning, which was really well attended. Is doing that mapping exercise and getting out there and getting youth people that want to get involved in developing this piece of work. So the volunteer offer and recruitment drive is now key, and it's looking at how we're going to change what the role specs are going to be to fit in with this new virtual world. I need to reopen the office, and I'm keen to do that for the 5th of October. From a face-to-face engagement perspective, we're currently looking at risk assessments there as community centres are back up and running, to try and get more engaged with some of the seldom heard groups. There's key voices that we know are not being heard at the moment, such as travellers, asylum seekers coming into the borough. So we're really keen to try and work out how we can get further feedback from them. And then it's that time of year where we have our annual 360 stakeholder review. So previously we did it, last year we did it as an engagement event for the first time, which was really, really good. So I'm really keen to do it as an engagement event, but obviously it'll be in a virtual format. So that's coming up in November. So something to be aware of. So the green is the external, what's next for us at Health Watch. So there's a second equality assembly being run, which has got a big focus on youth and age. And again, I'll be presenting to the full, there's 78 people that are attending that. I'll be presenting an update from Health Watch Rochdale, as well as holding a breakout room specifically around health inequalities again. The Together Rochdale group is developing and will be developing, and I think it's just understanding where that sits with us and how we can scrutinise and tackle some of the barriers there that we're facing. But it's going to be a big piece of work moving forward. So obviously we've got the commissioning intentions on public engagement, and it's that high level information at the moment. There's nothing specific coming out of, we just want to get a feel and ask for reflection on some of the information that's coming through there. And we're going to be doing that through our focus groups. And then obviously you said we did, which I've touched upon, is that public facing survey report, which is going to be a partnership approach to really show the residents on the back of their recommendations to the system during the COVID period, what has actually been listened to and what new services have come into play since that. So that's it from me. Sorry, I feel like I spoke for ages there. So I'll stop sharing my screen and take any questions. Switch my camera back on.
Thank you very much, Kate. I think what is clear is that you've all been very, very busy, as well as being involved in a lot of the things to do with COVID. So thank you very much. I know it's been a very stressful time for you all, and working remotely probably hasn't helped, because some of these things you need to bat ideas off each other, but you can't do that the way we're working at the moment. So thank you very much. Does anybody have any particular questions?
You talked about a survey, Kate, involving 700 responses.
Yes.
What was that on?
So the survey was asking around, it was a survey to ask questions, and it was quite a long survey around how it was at the beginning of lockdown. So it was how people are coping with lockdown. So there was loads of questions such as, has the mental health been affected? How they found out about local information? Where they received that information? So I will share, I'll share the findings of that report with you. So that you've got that. And like I said, that's the report that we're now looking for the external public facing update to come out of.
Right. And how did you get 700 responses? That's a pretty good response rate.
So it was a partnership piece of work. So it was pushed through council mailing lists, which is something that we've never hit before. And we've got new relationships now since the beginning of COVID, and me being pulled into, you know, away from what our normal remit would fit within. I've been introduced to new members within the council team under engagement and so yeah, new relationships there, and it's really opened avenues for us, but still holding our independence.
Oh, good.
Thank you. Anybody else have any questions?
I think Ben wants to come in, Jane.
Hiya. Firstly, apologies for being a little late, and apologies that I might have to leave at short notice with everything going on. I just want to say I thought it was an excellent presentation, and thank you to Kate, and thank you to the staff as well. I think there's a lot of positive things going on.
Thanks, Ben.
Thank you. If nobody else has any more questions, we'll go to the advisory group report. And I think, Karen, you're going to talk us through that.
Yes, thank you. Hello, everybody.
Hello.
Hello.
I don't know about you, but after that presentation from Kate, my brain's still spinning. So there was a lot there, Kate, so bear with me. The advisory group met on the 26th of August, and it was an important meeting because it was really the first meeting we'd had more formally as a group. There'd been meetings before where we were sort of thrashing out, if you like, what the group should be about, how it was going to look, how it was going to operate. And we had put together with Kate a terms of reference and the role specifications that went to board but came back to us and asked for them to be fleshed out really a little bit more about how we were going to go about what we were trying to achieve, how we're going to get our outcomes. For the purpose of the new board members, I'm sure you've all read the documents, and I just wanted to reinforce really that the reason that patients have come forward and wanted to formalise a mechanism, if you like, for gathering grassroots information is that when patients engage with organisations across the healthcare provider commissioning structure, the feeling you get is that if there's a predetermined reason for that engagement, quite often the patient voice is heard only if it fits with that predetermined agenda, and there was a need for an independent group that could bring issues forward that didn't necessarily fit in with the agendas. And whilst there's PALS, again, the mechanisms didn't seem to be there for patients to affect change, if you like, from their feedback. So that's the reason that we've put the terms of reference together as we have, and that is to try and to make connections within the community to gather that grassroots information of lived experiences, and then to have the channel of the advisory group to bring to board to then determine how we can move forward with this information. And a secondary sort of role, if you like, would be to form those connections with the healthcare organisations, so that we have a mechanism to work with, because quite often patients find there are no real mechanisms. You can make a complaint and that seems to spring things into action, but if you just want to work with the organisations, and quite often it's just, you know, bread and butter stuff that you would expect, safe discharge, availability of dressings, post-operatively when you're discharged home. Those are just a couple of examples of things that we've encountered, that we need to be able to formalise, to take forward. So I'm sure you've looked at the terms of reference and the changes we've made to the aims and the mission. I don't know if people want to comment as I'm going along, or do you want to ask questions at the end?
It's perhaps easier if people ask questions at the end, Karen.
Okay. So we did make changes as requested, and we would ask that the board have considered those, and hopefully they meet your requirements and that we can ratify them. So moving on from that. At the last meeting, we had a big discussion around how we could recruit new members. I think we feel that there is a fatigue out in the community. Some of that is because, obviously, of COVID. But prior to COVID, there was a fatigue, I think, among a lot of the patient representatives and participants that I'd certainly been seeing regularly. I've been, you know, involved since 2012 in PPGs with the various organisations in their initiatives, and tried personally to engage with the corporate level as well. And there is definitely, because of the way that the corporate structures are set up, trying to further your feedback in a proactive way. Again, like I mentioned before, there just isn't the mechanisms there or the understanding. And I think patients do feel, there's been a lot of motivated patients I've come across and members of the public, but a fatigue kicks in because you just don't feel as though you get anywhere. So we decided that there would be an action to set up a task and finish group that would make sure that we can broaden the potential for recruitment, to make sure we're as inclusive as possible, to overcome IT barriers, language barriers, and we need to gain trust again to overcome those, you know, sort of COVID fatigues, and obviously now we're going to have extra barriers with fatigue. I've encountered it today. I've had some members of the PPG that I'm involved with contact me, and they said they don't want to get in touch with me via email or anything like that. They just want to speak to me on the telephone. So I'll be doing that later. But, you know, we're working with people from various age ranges, and many that I've been working with as a volunteer, you know, are from the older age range, the more mature age range, and they are reluctant. I think they like to do face-to-face and be on the telephone. You know, I think we've all had to sort of learn how to work with Zoom, and it does put barriers there, that when you're face to face and when you're sharing lived experience, you need to be able to feel that you are being received in the right way. And I think some of these digital modes do interfere with that. I've been asked by Naomi to look at the facts that she's put together on the advisory group, so that can be ready, obviously, for Monday when we go live with our recruitment campaign. So I'll make sure that that's updated. Just checking that I've said everything I need to there. Right. So moving on to communications. We recognised a need when we spoke that, and it came to be in discussing how we were going to work as a group of patients together and then work obviously alongside Healthwatch members, that we needed email communication between us, and a general email for external contacts as well, and that's being set up for us. And there will be a code of conduct that will go along with that, that we all have to sign. Just bear with me. Yeah, just moving on to how we are going to engage externally. So we realised that once we started to get into what the advisory group needs to achieve, that there's going to be a lot of groups that we're going to need to engage with, and we're going to need to rationalise and prioritise how we do that, and also how we're going to do that, you know, in the face of COVID, so that the group can function efficiently. So that's some work that we're going to be picking up moving forward. Actions I'm sure that you can see there. We're going to hopefully gather grassroots information from logs of calls and emails received through the Healthwatch office. Kate's already mentioned care opinion, which I've seen in action just through the PPG. That was very useful to us to see what other patients had said about services, and we realised that actually through care opinion actions are triggered, so that was a positive for patients. And I was going to mention interim views there, but Kate has already updated us there on moving forward with that. We also discussed any current issues. We were able at the group, we achieved more than I think we thought we were going to, and some issues were raised. Rosemary raised the issue that patients were being diagnosed over the telephone that they had dementia rather than face-to-face consultations, and we questioned whether this was effective. And we'd like to know how that can be possible. So that's being taken forward by Kate. The issue of care homes not still being able to visit, and the mental health issues that are arising from that for both relatives and residents. Hospital appointments. Why are these not back to usual capacity was a question, and there are massive delays that we can foresee in the future for months ahead, and obviously members wanted to raise the issues of you know, how can we find out when normal activity will resume. We looked at accountability. Javid raised the issue. There's a piece of work that had been carried out at the Willows between Public Health and the CCG and the Council, and it had been lost regarding their response to COVID. And he asked the question, how could this happen, and wanted us to look into that. And also discuss the barriers with engaging with members of the BAME community, and felt that trust had been lost, and as a result that members weren't engaging, particularly after the announcement by the government about COVID rules, and there were new restrictions before Eid. And obviously at the time, Javid raised the matter that numbers were being seen to raise in these communities. So we asked that would be forwarded through Kate, because obviously that's an immediate public health matter. And so we're very keen to make sure that when issues are raised through the advisory group, that members are seen, can see that we do action as a result of those issues. And I think moving forward, when we have invited members of the public who come forward, it's a public advisory group that, you know, it is a group that is seen to action their comments. Kate's already mentioned, we looked at the update from Kate, it's our CEO, and the workforce feedback to help inform recovery plans report. So I don't think there's anything I can add to that. We also had meetings set up to meet with the Rochdale Citizens Partnership with Helen Chico. I know Kate didn't make that meeting, but I attended, and I found it very, very informative and useful to see what's happening out in the community with less resilient members of the community. And we discussed at length how we can work together. And we realised that a lot of what we're trying to achieve overlaps, and that they work with members of the public that they felt would be able to come to the group and bring issues that they would need to address. So we're quite hopeful that moving forward, the groups can work good together. And a big point about patient feedback is that connectedness. So it's going to be so important in trying to work with organisations that we do make these links, because there's lots of silos of patients working in groups trying to, you know, bring forward information really to improve the quality of care and patient safety, but not finding any mechanisms to work with. So we're hoping that this group, the advisory board, will provide that point of contact that's so needed. I have been reasonably active, despite I've got to grips with some of the virtual modes. So I've tried to continue the contact that I've been doing in the community, and also wider with the CQC. I've engaged with their initiatives online. I've engaged with the Health Watch England committee meeting, and I've got an outstanding meeting with Imelda Redmond by Zoom. That's in a couple of weeks regarding some issues I raised as a patient there. I have tried to contact the LCO. I think as a patient, we're very sensitive that the organisations are obviously preoccupied at the moment with COVID. So it's been difficult really to do anything, I don't know what the word is, but not wanting to, you know, you feel like you're being a nuisance being a patient sometimes when you're trying to do patient feedback work. But I did have a meeting with Deborah Lyon from the LCO as a result of a series of questions that we'd asked through the PPG that I'm with in Newhay and Milnrow. And those questions were based on basic everyday cares that several members had reported through our PPG, and we tried through local channels of patient feedback to address those concerns, and actually got nowhere, and that's over a period of 2 to 3 years. We went through the CCG through our practice manager, and it just appeared that, you know, that although you can take it forward, there was nothing to come back to say that anything had been done or how it had been done. So we decided to write a letter, and we sent it in the interest of sharing our experiences locally to Greater Manchester, because we recognise that across Greater Manchester there's varying levels of understanding among the corporate level of what patient feedback can offer, when you've got rapidly changing services, and many patients don't understand why services aren't there anymore that were, that services are operating differently than they used to do. And we had a response, and I was directed to our local services. There were some assurances in that letter that work is being undertaken, but as Kate alluded to before, you know, the parity given to patient feedback in organisations doesn't appear to extend to important groups that are involved in transformation and that change, and the live information that patients can offer to give them an understanding of, you know, what it's like to experience the changing services, and some of the issues that have been raised, you know, that they involve patient safety issues. We talk about high quality care, but it's not always spelt out what high quality looks like. And so as patients, we wanted to say that actually, you know, what we had received wasn't even basic level of care, actually. If you can't get hold of dressings post-operatively, just one example. And we felt that it should be resolved easier in the community. And if you fall outside of the national agenda, initiatives like diabetes, stroke, heart attacks, then there aren't those mechanisms to address these issues.
Sorry,
So,
Karen, can I just halt you there? I'm just conscious of the time and that we need to go on to our part 2. Is there anything absolutely urgent that you need to say? Because we need to obviously approve the terms and conditions. My computer keeps telling me I should be somewhere else.
yeah, no, that's fine. I was wrapping up there anyway. So it's a lot, isn't it? So yeah, no, that's fine.
So we obviously need to approve the terms of reference and the role spec.
Yes.
For that. So can I ask the board members, are those terms of reference and the role spec agreed? Any comments from them at all? No.
I found them fine. I was fine.
Fine by me.
Sorry, you're on mute, Rosemary, if you were trying to speak. You're still on mute. No.
It looked fine.
No, I was just saying fine by me.
Right, you're there now.
Yeah, fine by me.
Good piece of work. Thank you.
Yeah, I thought the same. Good piece of work.
Thank you.
And can I just come in there from a development perspective of the advisory group? I think from an operational perspective, I'm really keen to develop this group. So like I said, the feedback that we're getting through the organisation will come into the group. And you know, so Karen, just touch upon something that you mentioned there around the stuff that's been raised with myself on the back of the last advisory group meeting. So what we need to think about now is how that work is then picked up. And we need to think about, you know, that framework around, I've got to think about capacity, and that's not me pushing the advisory group back on any key pieces of work, but obviously some of it's around that capacity, and it's about us making sure that as an operational team, we've got that level of reactiveness in order to fulfill the role of the advisory group. So what I'll do is
come in there.
Yeah, of course, absolutely, yeah.
I think it was important to remember that the group is a facilitative group. And so a big part of what we're doing is making those connections so that that work can be forwarded.
Absolutely, absolutely.
Yeah.
And I think for
so
me,
we should be a channel.
Yeah, but for me, it's working out what that process is now, because that isn't in place. So I think we need to understand expectations. So for me, you know, as the advisory group, it's about me going away now and looking, right, okay, we can look at your issues that you've raised this time, but what is that future sort of like time frame and expectations there? Because I'm not saying we're not going to do it, but it needs to be realistic in line with everything else that's going on. And I think it's that two-way process of you feeding in, and like we've already established, me coming back to you and giving that update as well. Unfortunately, I was off on annual leave for the, for the first advisory group, but I'm really excited to see this develop further, especially from an external perspective.
Yes.
Around the commissioning intentions and stuff. So yeah, thanks for coming. I really appreciate your update, Karen. Thank you.
Thank you. Thank you.
Thank you very much. Was there any other business, Kate? Been
Not for me.
notified? No. Okay. Right. Well, can I say thank you all for your participation in what has been a very different public board meeting than what we've had in the past. So thank you very much. Thank you for your patience where we've had a couple of little glitches with technology. That always happens. So I think we all have to sign out, don't we, Kate, and sign into the next one?
Yeah, so there's a separate link been sent
So
for part 2.
if I can say thank you very much. And the board members, if you could sign out and then sign into the part 2 meeting, I'd be very grateful. Thank you.
Thank you. Bye.
Thanks.
Bye.
Thanks all.
Bye.